Hi, this is Dr. Ladd McNamara, and we are going through supplements for recovery. People ask me many times, "Hey, Dr. Ladd, what can I use to supplement for my recovery from whether it's broken bones?" I've seen that a lot. People lately who've had some fractures of their foot or their arm, injuries, or even surgery. What can you do post-surgically? So we're going to talk about some of those things. I just want to let you know this is not medical advice. And none of this, what I have to say, is meant to diagnose, treat, cure, prevent any disease, and that to consult your physician, your personal healthcare provider regarding any supplement use. So this is, again, information only. So let's start with broken bones. Broken bones are very common. There's about, 8 million broken fractures every single year in the United States alone. And that being the case, it's very common. And most of you have probably experienced a broken bone or a fracture sometime in your lifetime. Average healing time is about 6 to 8 weeks. Now, the average healing time of 6 to 8 weeks, it depends on what bone is broken, whether it's a small bone or a large bone like the femur. The femur is going to take longer to repair than a smaller bone, obviously. And also there are some other factors that can delay healing or even prevent healing, which we'll talk about, as well as what are the factors that can accelerate healing. And you guessed it, there are supplements that can accelerate healing, and we'll talk about that. What are the stages of bone healing? There are 3 main stages. Some people break them down into 4 or even 5 stages of bone healing, but there are three main stages. The first is inflammatory phase. The inflammatory phase, it happens almost immediately upon fracturing. Let's say a foot fracture, or you fall down, you see a rollerblade and you're skateboarding, and fall down and break your wrist. There's an inflammatory phase in which there's a blood clot. Because of the broken bone, there's blood supply around the bone and even inside the bone, and blood will seep out and form this clot or an hemorrhage, hematoma, that's right around the fracture site. So the hematoma will occur, and the inflammation will occur because of the cytokine release, and that will occur in the first week. Now, what happens almost within the next 24 to 48 hours after the break, within a couple of days, is what's called the repairing phase. This repairing phase is it's not the most critical, but it's a very critical phase. As long as the bone, the end of the fractures are reapproximated, as opposed to, they're in different directions, and one half of it's this direction, the other half's into a muscle somewhere else, that's a problem. That needs to be fixed. But as long as the bones are near each other, the ends of the bones, the repairing phase can start. This repairing phase will last usually 3-4 weeks or so. But what happens is that cartilage starts to form. The chondrocytes that are near the ends of the bones will start to produce collagen and cartilage. Well, cartilage is made of collagen, and as well as other micro blood vessels will start to form around that area to bring micronutrients to it. Now, that cartilage that forms around the fracture. So this is, let's say, the bone, and this is the fracture right here. These are the bone fractures. The cartilage or callus will start to form around the ends of the bones. And it will just be kind of this lump. So if you see a broken bone that has this lump on the end of the broken bone, that's the callus. It's a soft callus at first. It's a bony callus, and this is and that's what starts the building process, the repair process. This is a very critical phase. And now as it continues, this callus starts to grow, the cartilage grows, it'll start to come together and reapproximate the gap there. And then will come together and form one callus or one lump around the fracture like that. And that's what you want to happen. So this helps stabilize the fracture. That's why it's very important. There are things that will impede this process, impede the stabilization of it. And if the bone's way out of place, then what will happen is the doctor will go in and reset it. We'll do a reduction. That means that we'll kind of fix it to put the bones in place. And if they can't do it with your arm without doing surgery, then they'll have to do an open reduction where they do surgery and they cut open the tissue, go in there and put in a pin and to place it. That's what's called an open reduction. And they can put pins in the bone, or they can put pins through your skin and hold the bone in place, etc. But we're just talking about in general right now is that a bone, the typical type, would you wear a cast or a foot cast or a pad and go around with a scooter or crutches, whatever you need to. But this callus will reapproximate that bone, that gap. As I mentioned, the callus is made out of cartilage, and also there's other cells, fibroblast cells. There's this connective tissue that starts molding together to hold that bone together and to bridge that gap. The blood vessels are there, the microblood vessels are there to help deliver the nutrients. Which nutrients? Well, you need calcium, of course, and there's vitamin K2, and there's other things which we'll talk about, but deliver the micronutrients to it as the bones go. Now, the soft, spongy bone is the callus. It's the start of the calcium and the protein process, the protein being the collagen. Now, if we get to the third phase, and I'm just 1 and 2 are just a repeat of what I just said. The third phase here, this is the strengthening, the hardening of the bone, the remodeling of it. So that stage is called the bone remodeling phase or the hardening phase of the bone. This can last weeks, months, sometimes years. Doesn't mean you have to be in a cast all that long. You can still use your arm, your foot, or your leg before that, but it just, to get back to normal strength, it can take a long time. Now, this is where solid bone, the calcified bone, the calcium phosphorus, replaces the soft callus, the spongy callus. And that starts taking place as early as 3 weeks, and it can last as long as, at least the most critical period, can last as long as 12 weeks. So that's why somebody might be in a cast for 6 to 8 weeks, sometimes a cast for 12 weeks, depending on the bone. As I mentioned, some larger bones take longer, or if the bone is a more complex fracture and there's several pieces out there versus just a more of a simple fracture or a hairline fracture, that will take even shorter amount of time. So this bone remodeling phase, or this hardening phase, is where we want to focus on, and that is it's basically the replacement of the soft spongy callus with the calcium. Now, as I mentioned earlier, it's about 8 million fractures every year in the United States. Well, here's the problem. 5 to 10% of fractures fail. In other words, there's not a union of the two ends, and you don't get the healing process. And there's reasons for that fail. They could fail. So that means there's about 400,000 fractures in the United States that don't heal. That's a lot of people who experience non-healing bone. They should be healed within 6 to 8, 12 weeks, and they're not. And they continue, and they have prolonged pain and healing. That's what Heather, my wife, she's seeing now in the other room right now, seeing somebody that's with her foot. She's broke her foot a few months ago, or 2 or 3 months ago, and she's still been in a cast and not walking, and she just needs some extra help to heal that process along. So there's a failure of microvascularization. In other words, the blood vessels don't start growing, and if the blood vessels aren't there in that callus, then how can they deliver the micronutrients? And we'll talk about what can cause that. Or the calcium doesn't get deposited. The calcium and phosphorus doesn't get deposited in and replace the soft spongy material. What would cause that? There are things that will cause that one, and we're about to find out right now what it is. What are the risk factors for non-healing bone? Well, it could have a severe fracture or a complex. There's pieces everywhere, and that needs to go in and have an open reduction or some kind of other type of repair process. Diabetes can cause a non-union of the fracture or non-healing fracture because there's decreased blood flow because of damaged blood vessels. So the blood vessels, the microvascular tissue or cells in that area are damaged, and they don't have good blood flow to it. And then without the good blood flow, you don't bring the micronutrients, and you can't get the calcifications there, let alone maybe the cartilage may not grow as well as it should. Or anticoagulant medications can impede the repair of the healing of the bone. Non-steroidal anti-inflammatory drugs, particularly COX-2 inhibitors, will stop or impede the bone healing. They reduce inflammation, yes, and inflammation is a part of the healing process, but in and of themselves, they actually impede the bone healing, and it's not because it reduces inflammation. A lot of doctors will think, oh, well, we need inflammation, and if you stop the inflammation with antioxidants and antioxidants, which are also anti-inflammatory, then there's going to be a problem. We're going to find out why that's not true. But non-steroidal anti-inflammatory drugs, particularly naproxen, which is a COX-2 inhibitor, that's the worst. The COX-2 inhibitors at slowing down the healing process. Arthritis can slow down because you have the chronic inflammation. See, if inflammation was absolutely necessary for healing, then the arthritis should have a lot more healing or more inflammation, so therefore it should heal faster, whereas it doesn't. Excessive oxidative damage inhibits the healing of the bone. That's the thing that doesn't tell you. So it's a little paradoxical about using the non-steroidal anti-inflammatory drugs, and we'll get to that in a minute, of how solving that puzzle. And the last thing is smoking. Smoking by far will impede the healing of the bones. If you are a smoker and you fracture your bone and you want it to heal faster, one of the best things, other than taking quality supplements that you can do, is stop smoking or reduce your smoking so that the bone can start healing. And then there's also many other benefits to stop smoking, but that is one of them. So the question, I already said it, but let's make sure I want to emphasize it. If inflammation is necessary for bone healing, won't the antioxidants, let's say grapeseed extract and others, won't that slow the bone healing, as do the non-steroidal anti-inflammatory drugs? This is key to understanding the process of when you break your bone and the doctor says, don't take any anti-inflammatories because it'll slow down the bone healing. You're thinking, well, my grapeseed extract acts as an anti-inflammatory, so I better not take it. Does it? Do the antioxidants slow down the bone healing? No, they don't. That's not just me. The studies show that. The studies show it, but a lot of doctors don't understand why that's the case. So let's understand why. Antioxidants, including grapeseed extract with vitamin C particularly, and many other antioxidants, accelerate bone healing. Even though they have an anti-inflammatory effect, they actually accelerate it because of the benefits of helping with the collagen formation, the cartilage formation, the soft callus, and the effects that it has on the bone cells called osteoblasts. Certain antioxidants, vitamins and minerals, actually stimulate osteocalcin, the hormone that helps with the deposition of calcium into the bone and strengthen it. Whereas non-steroidal anti-inflammatory drugs, not NSAIDs, particularly high dose and long-term, longer than a couple weeks, it slows down the bone remodeling, that's the calcification, the hardening of the bone, because it slows down collagen formation, and it slows down because it reduces the hormone effect of the osteocalcin. It will reduce calcification. That's the effect of non-steroidal anti-inflammatory drugs like Motrin or ibuprofen or Aleve, naproxen, or what's the other name for it? Anyway, the trade name for it. But that's the point. It affects it differently than the antioxidants like grapeseed extract or curcumin. What the antioxidants do, they reduce excessive oxidative stress that's going on. The oxidative stress, it prevents, oxidative stress, it causes apoptosis of self-destruction of the bone cells, osteoblasts, the bone cells that are laying down the calcium, the hardening of the bone. The oxidative stress will impede that. So the antioxidants will reduce that excessive oxidative damage without impeding the osteocalcin. And in fact, it actually helps induce the osteocalcin. It helps stimulate that hormone to be able to, and particularly along with vitamin K2, to help lay down the calcification. And it also helps with collagen formation, the grapeseed extract with the vitamin C. You see, so that's the answer to why it's still beneficial to take it. So what are some of the things? I just listed a few. Calcium, magnesium, these are things that are needed and actually have been shown to help with bone remodeling. That means strengthening, hardening of the bone. Selenium and zinc minerals. Vitamin C, vitamins A, B, and C. Oh, I already said that. Vitamin E, vitamin D, we need that. Vitamin D is important for, obviously, for bone strength and bone growth, but along with that is vitamin K2. Not just vitamin K, but K2. K1 is important for the blood clotting. Vitamin K2 is critical for putting the calcium into the bones where they belong, for bone remodeling, for strengthening the bone. To take the calcium, you don't need excessive calcium, because if you're having a good diet and taking normal doses of calcium, let's say 1,200 to 1,500 milligrams of calcium per day total, that's enough for bone remodeling, for bone strengthening, particularly if you have these other antioxidants, other vitamins and minerals, and vitamin K2. And if your osteocalcin is working, and if your osteoblasts are not being disrupted from excessive oxidative damage, or from cigarette smoking, or from diabetes, or anything else that also increases the oxidative stress. Vitamin K2, a grapeseed extract, alpha lipoic acid. You can find alpha lipoic acid in a quality liver support supplement. And there's many other antioxidants in there too that are beneficial. Glucosamine and curcumin, or which is also known as turmeric extract, the combination of glucosamine and turmeric, that actually helps with cartilage formation in that soft tissue, that soft spongy callus on the ends of the bone. So that's often found in a joint support supplement. A quality joint support supplement will have glucosamine and curcumin in it. And that's helpful as their bones starting to, it's not just helpful to help support, help with the joints, it's actually helpful for the remodeling, the strengthening of the bones and the part of it. So how much? So people want to know. So I just jotted down some things that, this is what I would do. This is not medical advice for any of you out there. This is what I would do for a fracture. I would make sure I'd taken calcium, a good quality calcium, about 1,500 milligrams a day total. So between my foundational vitamins and minerals, along with an extra supplement, it would be just a foundational supplements. Plus I would take 4 maybe chewable calciums, maybe some other activated calcium with some magnesium in it, around 1,500 milligrams a day. That would be plenty. You can do as little as 1,200, but 1,500, you don't need to do above 1,500 milligrams per day. Let's put it that way. Vitamin D, I would take personally between 8 and 10,000. I would lean towards the 10,000 IUs per day. I'd even might push it to 12,000 IUs per day, but that's the range that I would take it in. Vitamin K2, I get some quality vitamin K2 tablets well, some of it's already in my foundational quality supplements, but some of the vitamin K2 comes in a standalone vitamin K2 tablet with 180 micrograms. I wouldn't just take one a day, because I want to be able to help that osteocalcin. I want that calcium to be deposited into the bones. I would push it up to 4 or 5 tablets a day, if not 10 tablets a day for the first couple months. Maybe 10 tablets a day, get a total of 1,800 micrograms per day. And if you're thinking that's too much, Dr. McNamara, you're gonna kill somebody with that kind of advice. Well, go look at my article at ladmcnamara.com. That's my name. You can see it here on the post. It's www.ladmcnamara.com, and you can look at the article there on vitamin K2. Look at the things I have written there about how much vitamin K2 is safe, how much is it beneficial to take it out of the soft tissues like the arteries and put it into the bones. You want it going into the bones at the time of when you have a fracture repair. Grapeseed extract, I would take at least 400 milligrams a day, 200 milligrams twice daily, 200 milligrams 3 times a day. To take up to 600 milligrams, that's fine. You don't need to overdose on it, but this is helpful to take that much. You can take more if you want, but I would take at least that much. The joint support supplement, I would take at least 3 per day and maybe push it to 4 a day, but I wouldn't go over that. I would not go over 4 tablets of a quality joint support supplement per day, with the glucosamine and the curcumin in it to help with the cartilage, particularly initially when you want to have that cartilage forming around that the fracture for the soft callus. And then, of course, this is all on top of a high-quality foundational vitamin and mineral antioxidant fish oil supplement. Well, here's the thing. The bone healing continues for months beyond you're out of your cast, months beyond that, even years. It's continuing to remodel and strengthen. And according to, in response to your stress, in other words, the stress is the physical activity. The more you use a bone or your arm, your muscle, the bone will strengthen. Just like you use your muscles, you'll strengthen your muscles. You walk around more, you will strengthen your bones in your legs and your back and your hips if you use them. If you have a sedentary lifestyle and you're not using your bones and not walking around much and you're just kind of, let it deteriorate, it's kind of use it or lose it. That's what happens with both muscles and bone. So your bones strengthen with use of it. So although you will be immobilized initially from your using, let's say if you break your foot, you won't use your, you'll be on a cast and be off of it using crutches or even better yet, a scooter to get off your foot. But at some point, you're going to be using it again to help strengthen it. And then, of course, micronutrients. I already mentioned the micronutrients, the vitamins and minerals. And then, what else can you do? People have asked me this, so I'm going to answer this. And that is, you can literally accelerate bone healing and other type of healing, soft tissue healing, surgical healing. You can accelerate this with electrotherapy. There is such a thing. This is not the forum to go into that in depth, but I will give you that information. It's specific electrotherapy because there's many types of electrotherapy that do not work, and there's not effective and is shown to not work. This one works. I know it with my own son Michael when he fractured his arm. I've seen it with my wife Heather when she fractured her back, and I've seen her now as she's treated so many people with fractures, and she's in the other room right now treating somebody with a foot fracture who wasn't healing, and this is exactly why. You can read about it. Go to ladmcnamara.com, the same place you're going to read about vitamin K2. There's a menu option at the top. You'll see the menu. It'll be, say, electrotherapy. There's an article on electrotherapy. You can read about that. You can read about how it can accelerate the healing process, particularly for non-healing fractures. What about post-surgical recovery? And this is the last part of it. Or injuries, the same thing. Post-surgical recovery, if you had a surgery, make sure you can talk to your doctor and it's okay to take some supplements, because let's say if you're at risk for bleeding or hemorrhage, you don't want to be taking supplements. Let's say if you had if you had a surgery and the doctor said everything looks good, there's no excessive bleeding, no risk of bleeding, you go home, and if this was me, this is not for you, this is not medical advice for you, this is if it was me, and I had surgery, and let's say an open surgery, a laparotomy where they had to go inside and say took an appendix or do other type of cutting inside. And then once I got home, I was eating fine, and they could say I could walk and eat, and then I wasn't at risk for bleeding anything. I would start my supplement regimen right then and there. But if I was at risk for bleeding, let's say it was a woman who had a DNC. I had patients where I do a DNC, or they had some excessive bleeding in the uterus, and I was worried about I didn't want to have them bleeding out the uterus or just had a baby. I didn't want to have them have extra bleeding by putting them on high-dose grapeseed extract, which can thin the blood and can put you at risk for a little extra bleeding. So if you're at risk for bleeding, don't boost up that grapeseed extract because it will cause them a little extra bleeding. But if everything looks good and the high risk for bleeding is gone, the same micronutrients that I mentioned earlier in this video for the bone healing, you can use them for healing of injuries and or healing post-surgical. Of course, if it's post-surgical, you wouldn't need to be on excessive or extra calcium, just regular doses of what you take of calcium and magnesium. You can be on regular doses of vitamin K2. You wouldn't need to be on higher doses of vitamin K2 because you're not worried about healing of a bone, you're just healing regular tissue. But you want to take at least an additional 180 micrograms of vitamin K2. And you don't necessarily need to be on a joint support supplement unless you want to be for your joints. It's helpful for cartilage and collagen formation, but particularly the glucosamine helps with the chondrocytes, the ones that actually produce cartilage. So if you need cartilage to heal, then being on the joint support supplement would be beneficial. So with that, I think that's about it. I'm going to look at see if there's any particular questions here, which I was the, and well, thank you very much. I appreciate your kind comments and appreciate that. All right, good. Hey, you know what I'm going to do? I'm going to post after this video. I'm going to put in the comment section. I'm going to post a little video of what Heather's working on Ivy's foot right now. Ivy's broke her foot a couple months ago. She came down from San Francisco to have Heather treat her foot. She's been treating yesterday, today, and she'll treat her tomorrow. And I'll show you kind of what that looks like if you're interested in it. It's for non-healing fractures. This will help accelerate it. When Heather saw Ivy at convention, she was hobbling around. Well, Wilson was pushing around in a wheelchair, and she wasn't healing right, even though she's taking all the right supplements. She's not a smoker. She's not diabetic. It just wasn't healing. Just one of those things. And so she needs that electrotherapy. So I'll just show you a video of that. I'll post that in just a few minutes underneath this one. All right. Have a great day, great week. Take your supplements, take your quality supplements, and we'll see you later. Thanks for joining us. Bye.